Have you ever stopped to think about what goes on behind the scenes to make sure the medicine you take is actually pure and safe? It's this whole invisible, super high stakes science, and it's all focused on one thing: preventing one powerful drug from accidentally ending up in another. So today, let's pull back the curtain on the science of clean. And really, this is the million-dollar question. I mean, just imagine it. A factory is making, say, a really potent heart medication on Monday. And then on Tuesday, using the exact same vats and pipes, they switch over to a common pain reliever. So how clean is clean enough? The answer to that question is absolutely critical for your safety. For decades, the way the pharmaceutical industry tackled this whole problem was with a set of, well, surprisingly simple rules of thumb. The problem was they were a sort of one-size-fits-all solution in a world that desperately, desperately needed precision. Yeah, so these old rules, they just don't hold up. A 10 parts per million limit, for instance, sounds tiny, right? But it's a totally arbitrary number with no real science behind it. Or how about 1/1000th of a dose? Well, that could be a huge amount for one drug and practically nothing for another. And my personal favorite, visibly clean. I mean, come on. One person's clean is another person's major cross-contamination risk. These old standards could be total overkill for a low-risk drug or, and this is the scary part, dangerously inadequate for a high-potency one. So that fundamental problem, it really sparked a huge paradigm shift. Regulators, scientists, they all kind of had this collective wait a minute moment. They realized that to truly protect patients, they had to ditch the arbitrary rules and embrace a completely new approach, one that was actually grounded in toxicology and a real understanding of risk. So the new gold standard is something called the Acceptable Daily Exposure, or ADE. Now, this isn't a guess. It is a health-based limit, calculated by toxicologists who pore over every scrap of data for a drug to find the absolute maximum dose you could be exposed to every single day for your entire life with no bad effects. Just think about how incredibly strict that standard is. This quote from a key industry guide really says it all. We're not talking about a one-time thing. We are talking about daily exposure for life by any route, swallowing it, breathing it in, you name it, and it still won't cause harm. That is an unbelievably high bar for safety. Okay, so with this new scientific foundation, the ADE, the industry needed a whole new playbook. And they found it in the established principles of quality risk management. This gave them a structured, repeatable way to make sure patients were safe. The whole philosophy is actually pretty simple, but it's really powerful. If you're dealing with a high-risk situation, like a highly toxic drug that's a nightmare to clean, you bring a very high level of effort, formality, and documentation. But for lower-risk stuff, you can apply a proportionally lower level of effort. It's all about focusing your resources where they really truly matter most. So let's see how this all builds up. These three principles, they come from a big international guideline called ICH-Q9, and they're basically the bedrock of the whole modern approach. First, everything's got to be based on science, no more guesswork. Second, the ultimate goal, always, is protecting the patient. And third, you don't waste time and money on low-risk issues. You match the effort to the risk. And miss right here, this is the playbook in action. A global standard, ASTM E3106, takes those principles and turns them into a super detailed process. It walks manufacturers through a cycle of identifying hazards, analyzing the risks, figuring out how significant they are, and then putting solid controls in place. It's not a one-and-done thing. It's a continuous loop of safety. Okay, so that's the philosophy and the process. But look, a system like this is only as good as your ability to actually measure the results, right? So how do companies prove their equipment is clean enough to meet these incredibly strict scientific limits? Well, for that, they need some pretty sophisticated analytical tools. The two main workhorses are called HPLC and TOC. Now, think of it this way. HPLC is like a sniper. It takes very careful aim to find and measure one specific target, the drug you're worried about. TOC, on the other hand, it's more like a wide net. It just sweeps the whole area. It doesn't tell you what it caught, but it tells you the total amount of all the organic stuff it found. So what you've got here is a classic trade-off, speed versus precision. HPLC is super specific, which is great, but it's slower, it's more expensive to buy, and each test costs more to run. TOC is lightning fast and cheap, but it's non-specific. It just tells you something is there. And the difference in speed is, well, it's dramatic. We're talking an average of 45 minutes for an HPLC test versus maybe 5 minutes for TOC. Now, when you have a multi-million-dollar manufacturing line just sitting there waiting for the green light to start, that 40-minute difference is a huge deal. So, at the end of the day, it's about picking the right tool for the right job. You bring out the HPLC sniper when the stakes are highest, for those extremely potent drugs or when you absolutely have to know what that residue is. You use the TOC net for fast routine checks or for finding things like leftover cleaning agents. In reality, a lot of places use a smart combination of both. So, we've got the science, we've got the risk management playbook, and we've got the high-tech tools. Let's bring it all together and see how this system creates safer medicine, not by chance, but by design. You see, the modern approach looks at cleaning not as a single event, but as a whole life cycle. It starts small, in the lab, designing and really understanding the cleaning process. Then it gets qualified at full scale, proving it works reliably time and time again. But it doesn't stop there. The process is then continuously monitored to make sure it stays in a state of control, basically forever. And that right there, that is the ultimate payoff. Every single piece of this giant puzzle, the complicated toxicology reports, the detailed risk assessments, those careful little swabs, and the high-tech lab tests, it's all part of one interconnected system that has just one single purpose: protecting the patient, protecting you. So the next time you take any medication, just take a second to remember the science of clean. It's a complex, invisible, and incredibly rigorous process. And honestly, it's one of the unsung heroes that makes modern medicine not just effective, but unbelievably safe.